Good morning. Of course, this is my first meeting, and I'm already 5 minutes behind. How about that? So thank you all for being here, and I would say it was a fabulous evening last night, and thank all of you for attending, and the families and the friends. It was just wonderful. I just want to point out that we have an outstanding program with a number of people, notable speakers, throughout the day's program, including, at the end of the day, the Secretary of Veterans Affairs, Robin McDonald. For those who have not met him, he's a really wonderful person, a personable executive who's brought a lot of really passion and skill to his job. And you'll be hearing from him at 4:45, so I hope many of you will be here and have the opportunity to, in fact, hear what he's got to say about the VA. He's very interested in taking his message on the road because he feels that in order to people to understand what his plans are, but also recruit the right people to VA, he needs to, in fact, meet many of you. And so please stay if you can, and it'll be a great conversation. So I'm delighted to have the opportunity to open the meeting to give you my first report since my term on July 1. And it is a great pleasure to be addressing you for the first time as the new president of the Institute of Medicine. Let me first say how privileged I am to be your president, to serve IOM, all of you, and the nation. And I'm especially pleased to see Stuart Bondurant, Sam Thier, Ken Shine, and Harvey Feinberg here because they have built the foundation of this great organization. And I'm so excited to build upon their work. Now, I've only been here at the IOM for a few months. I'd like to get to know all of you, and I hope you'll get to know me as well. I'd like to share today my impressions of the first 100 days. People say I'm still in my honeymoon. But in fact, I feel that I've been jumping in and already doing a lot of work. My initial activities in preparing for the future of the IOM, both in the context of strategic directions and the potential reorganization into a national academy. Importantly, I would like to get your input and work with all of you in positioning our great organization for the future. You know, it is daunting to think of the IOM's important mission and its contribution to health and medicine since its founding 44 years ago. Many of you know we can trace our origin to the National Academy of Sciences, chartered by Congress and Abraham Lincoln in 1863. Our purpose is not to function solely as an honorific society, but to serve the nation, to make real changes in the world around us. Indeed, over the years, we have much to be proud of, having made enormous impact on policy, care delivery, science, and medicine. The IOM's work has touched every aspect of health, from discovery science to care delivery, from developing a learning health system to creating healthy neighborhoods. You know, the New York Times described the IOM as, and I quote, the most esteemed and authoritative advisor on issues of health and medicine, and its reports can transform medical thinking around the world, end of quote. And the Washington Post recently, just a few days ago, quoted Nancy Lee, the Health and Human Services Deputy Assistant Secretary of Health, as saying that IOM, and I quote, is the gold standard for recommendations in the medical field. It has credibility and reach that nobody else has. Those are amazing statements they make about us. And of course, we take this with great pride and obviously take them very seriously. You know, as an IOM member for many years, and even as a council member, my biggest question was always, how much impact is IOM making? And now that I have an opportunity to jump into the organization and get to know it on a daily basis, I want to tell all of you that I'm truly impressed by what we're doing. Many of you know this, but next slide will show you that we have 9 boards, writing studies and hosting forums and roundtables covering topics that range from nutrition to child development to genomics to global health. All of this work is steering the direction of health and medicine in this nation and the world. Our work has changed how we practice medicine and transformed the way we care for patients. All of you know our To Err is Human and Crossing the Quality Chasms reports. They are the go-to resources for healthcare safety. They've sparked major quality improvement efforts and transformed care in the US and globally. Our Future of Nursing report has led to changes in the regulatory policy around nursing practice, improving the care system's capacity to provide patients with what they need. Our reports have led to healthier school meals for children, increased health coverage for preventive services for women, and changed the direction of research. Later today, we'll hear from Secretary McDonald of the Department of Veteran Affairs, who leads the spending of over $40 billion per year to provide health care to millions of veterans who've served this country so well. We do a lot of work with the VA, and our work has influenced the VA in many different ways, and in fact, how these dollars are spent. For example, response to a recommendation from a recent Gulf War and Health report, our report, the VA recently expanded benefits for the vets with traumatic brain injury. You know, these are real people receiving better care, real families less burdened by costs. I think this is real impact, and we are making that impact. And our forums make great impact too, as they convene stakeholders to discuss, review, and debate critical issues in health and medicine, design solutions, and catalyze partnership. Often, when participants from different sectors, different background, after a meeting and conversing with each other at one of our forum meetings, they start to do things differently. For example, after a workshop of our Health Disparities Roundtable, representatives from Walgreens and HHS partnered together to help uninsured to receive flu vaccine. Walgreens provided more than $10 million worth of free flu shots, and HHS distributed vouchers for them to approximately 350,000 eligible people in 15 US communities. I mean, that's real impact. And when you look at what else we do, recently NIH cited our work from the Genomics Roundtable in an RFA, soliciting applications to examine the economic determinants and consequences of personalized medicine. You know, we also can't underestimate the power of the relationships and trust that are built in these forums. I recently attended a meeting of our roundtable on value science-driven healthcare, where Patrick Conway, the Chief Medical Officer of CMS, updated the group on the Center for Medicare Innovations, CMMI, their ACO program, and the roundtable members who are CEOs of health centers, major private insurance, government and industry leaders were all there, and they were able to dig deeper into details of the data and ask questions that will help them to do their job better. Nowhere else would they have the opportunity to sit in a room together in this intimate setting and collectively delve into the nuts and bolts of those that will change healthcare in our country. In addition to our traditional reports and forums, we have developed new initiatives, innovative initiatives, some of them led by Harvey, such as the HBO series of Weight of the Nation that has made a major public impact. And we even made it to Hollywood. You know, the children's film that spun off of our Weight of the Nation work was nominated for a 2013 Emmy Award in Outstanding Children's Program category. I was looking for Harvey to go on stage, but too bad it didn't happen. But nevertheless, I think it says a lot about what we're doing. We're doing the traditional work of consensus report, we're having forums roundtable, and we even have initiatives that goes directly to the people. We are on a constant mission to improve our impact tracking. As you know, my predecessor pushed the IOM towards measuring our impact, and we've developed a database now on our degrees of impact. It's a thermometer, as you can see, and I think you can read the thermometer, how we measure impact. It's not easy to get a citation index or some of the metrics because so much of our work eventually make it into the government, into bills and policies, and take some time. So sometimes it's difficult to fully capture the impact of our work. As we all know, changes in our nation's capital can be slow, and new legislation resulting from a report may happen years afterwards its release. Going forward, I hope I can better document our impact through increasing access to data, constantly improving tracking systems, and stronger connections with the people using our work. As I assume the role of your president, I know I have the important task of continuing the organization's impressive trajectory at a time when there are many challenges and uncertainties. But I feel that I'm well prepared for this because of the input and support I receive from you, our members, the wise counsel and guidance that I received from the council, and the dedication of IOM officers and staff who are passionate and committed. I also feel that my background and experience have also prepared me well for the challenges ahead. As many of you know, I'm lucky to be an immigrant who's been given much by this country, and I feel privileged that now I have the chance to give back. Many of you know I was born in Shanghai, China, and as a young boy, my family left for Hong Kong, and my life's passion for medicine was surely seeded in my early experiences with poverty and disease in post-war China. At 18 years old, I moved to Canada to study at McGill University, where I received my bachelor in medical degree. There I met my wife Ruth, who's here, a native Canadian. We've stayed in the United States most of our life, where we raised two daughters, Jacqueline and Marissa, and we're very, very proud of them. I began my career as a physician scientist, and to this day, I continue to run the lab at Duke University with uninterrupted NIH funding. However, I recognize, of course, the importance of basic science research to improving clinical medicine. I've devoted much of my life to translational research, but I also had the privilege of serving as chair of medicine at Stanford at Harvard's Brigham Women's Hospital. 10 years ago, when I joined Duke, serving as Chancellor of Health Affairs of Duke University and the CEO of Duke University Health System, I immersed myself in leadership and care delivery and was also deeply involved with developing an agenda in innovation, translation, and global health. Throughout all these experiences, I became aware that healthcare is only a tip of the iceberg in the context of population and individual health. In my experience with the Durham community and other communities across the globe, I've seen how social, economic, and behavioral factors drive health and well-being, and how unemployment leads to stress and hunger, how poor education correlates with poor health, and how unsafe neighborhoods leave little room for building trust, and how it is much too easy to predict one's lifespan if you know the ethnicity or the zip code. This is why I've made a big effort to contribute to my local community outside the hospital. Indeed, I have the opportunity to develop social programs in North Carolina, including building an education to career system in Durham public schools for disconnected youth. So now here I am at the Institute of Medicine in the world of health policy. I feel that my experience as a physician scientist, health innovator, health administrator, and community leader have given me an understanding of the aspiration of the people in the front line, the challenges they feel in everyday life, and how policy can bring about positive changes. I hope that these past experiences will provide a useful compass that guides me to meet my future responsibility as your president. You know, IOM is positioned to make a difference to a nation and the world as there's never been a more exciting time in the history of medicine. We face unprecedented changes and opportunities. There are multiple forces that shape our health environment. So first, we live in a time of impressive advances in science and technology that are poised to transform and make transformative breakthroughs in medicine and health. You know, we can sequence a genome for less than $1,000 now, and who knows, maybe in a year, $500 or even less. We can gather health information from biosensors in and out on our bodies, and I can imagine it won't be long before we are able to see tumors right where they begin to grow in our body. You know, these advances will allow us to move from curative to preventive approaches and to a medical practice that is more personal and precise. We have sophisticated robotics, synthetic biology, genome editing, and we'll be able to regenerate organs after heart attacks and strokes. But despite and sometimes because of this great progress, we face many challenges. The ever-increasing technology and data comes a greater responsibility to use them properly. With big data, we need to address privacy concerns, data ownership conflicts, proper analysis of data. We'll have to confront technical and ethical issues of gene and stem cell therapies. And we do all this in a policy environment that isn't quite structured to keep up with the rapid pace of technology development. All of you know we're also seeing constrained government funding of research and development. NIH funding has been flat for almost 10 years, with a 25% loss of its purchasing power. A recent report released by the American Academy of Arts and Science noted that U.S. has slipped to 10th place among OECD nations in R&D investment as a percentage of GDP. It's projected that discretionary spending in this area will shrink from 35% to 23% of federal budget over the next 10 years. A recent Battelle report projects by 2020, China will surpass the U.S. in R&D spending. These are not good signs for research and innovation, which are the foundation of U.S. success and global competitiveness. Meanwhile, our demand of care is still growing. Non-communicable diseases are on the rise and our population is aging. And while the demand for better care rises, the cost of providing it remains high, and we still have deep racial, ethnic, and geographic disparities in health. You know, the solution to these problems is the development of a healthy culture, a culture of health, in which everybody plays their part to build a healthy society. Organizations like Robert Wood Johnson Foundation are leading the efforts to address health at its roots, to reduce the need for health care itself. This will require contribution from everyone, not only health professionals, and in fact we're seeing employers, city, local government, transportation departments, and schools paying more attention to how they too can foster a healthy culture. In addition, we'll need to involve many non-health disciplines, such as social and behavioral sciences, economics, engineering, etc. In this aspect, I would say that IOM is well prepared. We've always worked collaboratively with many people from different non-health areas, and in fact, since 1/4 of our members must come from outside the health professions, and I'm very proud of that policy. Ultimately, what I believe is a very exciting development, the increasing democratization of health. Patients are becoming consumers and have access to their own data and are leading change from the ground up. For these reasons, at IOM, we must engage people in all corners of our community. And finally, globalization. It is connecting people on opposite sides of the earth. Ideas, tools, social trends can spread much more easily now, and of course, so too can diseases and other threats. The Ebola crisis is an eye-opener, a wake-up call to our vulnerabilities in an ever-connected world, and to the unavoidable fact we can never be fully prepared for everything. So the question we must ask ourselves now is, how IOM will lead in this rapidly evolving health environment. We have made important contributions throughout our history. Now, as an organization transition, and with likely changes in our governance and organization, we have the opportunity to move ourselves forward toward a future in which we can make even greater change. To steer ourselves towards this future, we need to see where we're going. We need to set goals and build a strategy to get there. And currently, we're in the process of developing a strategic plan for IOM. This past July, your council, our council, identified 3 strategic priorities: advancing science and its application, addressing key issues in health and healthcare, and positioning the IOM and academies for the future. In this context, our staff and I have been undertaking many activities to prepare for the potential governance and organization changes ahead. Our staff have been working really hard to gather information on what IOM does well and what we need to improve upon and for the future. Staff at all levels contributed to analysis, what we call SWOT, our strengths, weaknesses, opportunities, and threats. We had a senior staff strategic planning retreat last month to discuss the information and map a way forward. And I had many lunches with the staff across the organization. We're also collecting data on the strength of our brand, our finances, our report production processes, and our organization structure to prepare for our up-and-coming triennial review. What we've been finding is that IOM has many, many strengths, what we call, quote, the IOM way. We have a great reputation, independence, a reputable brand, a strong connection between members and programs. Of course, we're not immune from threats given a very difficult funding environment. So we have to give serious thoughts to what our strategic plan will look like and where will it take us. We've also been looking for guidance from all of you and from the Council to work towards these things, and also look externally for guidance as well. So to increase our visibility and get input from our stakeholders, I've commenced a listening tour to meet with government, business leaders, academics, community-based organizations, families, entrepreneurs, to find out what they care about. You know, we kicked off the tour last month in San Francisco and organized 3 sets of meetings: members, community care leaders, and private sector business leaders. The business leader, Google, hosted, in fact, the Silicon Valley event for me. Sergey Brin, the Google's co-founder, opened this meeting in his workout gear, a true tribute to health, and they were as high-tech as you can imagine. But we had the fabulous conversation by really talking to people to say, what does it really mean to you in health? What do you care about? And how can IOM be a player and help you? I was in Boston last week and plan to be in New York City, LA, Midwest, and southern cities. I'll be continuing this tour throughout the year, and I believe it will strongly influence the direction that our organization will take. As we continue to plan our path forward, we must aim high to push the IOM to perform at its greatest level, to achieve all that we can imagine we could do and more. Specifically, we must determine how to make IOM ready, innovative, and even more impactful. Now, what do I mean by ready? Well, if you look at a rapidly changing world, we need to address the challenges that lie just around the corner. This may mean staying in touch and connected to what's going on outside our offices, and going a step further, being proactive in preventing future problems. During my very short tenure here, we have released reports that I think are especially significant, responding to the concerns that our population cares about. For example, the report on governance and financing of GME, graduate medical education, and report on end-of-life care, dying in America, have already generated such attention and debate and it's a good thing to have debate, that will lead, I'm sure, to substantial changes. When I was on the Hill speaking to different committees and others, and when I met with the agency, it's very clear they all read the report, and I think we're going to see something really good come out from all this. Not everybody agrees with what we say, but that's a good thing. We have stimulated and challenged people to think what we need to do in these very important areas. IOM does have much to prove that is ready, and then we can do more. The Ebola crisis is a wake-up call, and that we're not doing enough. Instead, we're desperately reacting in the face of failures of global governance, resources, workforce capacity, infrastructure. True readiness means that the world is equipped with a framework that one can follow in a time of surprising need. Indeed, right now I can tell you IOM is engaged in a deep discussion with key stakeholders about setting up such a global framework. So the world is much better prepared for any crisis in the future. In addition, in response to HHS, we're establishing a standing committee on medical and public health research during large-scale emergency events. And we're developing a public workshop on Ebola research education on November 3rd, which is open to the public. So please, if you have time, please attend and let me know what you think. If we want to think boldly about preparing for the future, and we want to realize the high standards of care that we aim for, we will need to make radical changes. We need to open our doors to new and perhaps sometimes uncomfortable initially ways of doing things, and to new ideas that come from all corners of society. In short, we need to become more innovative. There's a need for a health innovation ecosystem that provides technical, regulatory, resource, legal, and business support to innovators in US and abroad. And now I wonder how IOM too can contribute to this ecosystem. I know our primary job is to curate knowledge, analyze evidence, and distill it into actionable recommendations. Can we consider going a little step further and act as an innovation incubator? Think about this. IOM is one of the few organizations that could get the head of CMS, ExxonMobil, UPS, Rockefeller Foundation, Harvard, and Avon into one room to talk about how to improve health together. And we've done that. These convenings are bread and butter that happens every day in the academies. With this incredible convening power, what if we, in addition to writing reports and hosting forums and catalyzing new ideas, we host those people who are working together to develop implementable solutions? In other words, IOM could and should provide support to help a great idea, to develop a business plan and financing plan, address technical and regulatory issues, and plan the organization structure until the solution is ready to be launched outside of IOM. Certainly, as we are considering this direction, and only considering, we must stay true to our mission and core strengths. We must continue our great work on consensus studies that have been proven to be extremely impactful over time. We must remain as a trusted advisor and not become an advocate. In the dynamic world of rapidly changing health and medicine, we also need to innovate and serve our nation in new ways that are adaptive, nimble, and relevant. No other organization can stand still and expect to succeed. And I'm excited to see how IOM will creatively respond to the forces of the 21st century. Ultimately, the purpose of being ready and innovative is to make a real impact on the health of this nation and beyond. So we look in the future, you know, the images that come to my mind are not always pretty. You know, it's predicted in the year 2050, our population can be as big as 11 billion. And this world will require a 70% increase in food production. This world will also require 80 times more energy, leading to a 50% increase in greenhouse gas emissions. We know our water is running out, And in 2012, China's Ministry of Water Resources announced that 28,000 rivers have disappeared over the past 20 years. And there's still many, many people who have never had easy access to clean water in the first place. You know, this could be a very scary future, but it doesn't have to be. We don't have to let it get there. Being Chinese, I like to refer back to my roots, and in Chinese, there's a word for crisis. It's actually made of two characters. One says danger, and the other one says opportunity. I believe we have a tremendous opportunity. We have the knowledge, tools, and imagination that set the course of health on a new direction, a direction that shows that everyone has the health that they need to live a rich life. And we should not run from this opportunity because we only see danger of the mistakes we may make when we try to make the changes. One concern that many people have expressed to me that right now our world is under immense pressure, and everyone is hunkered down addressing challenges in their own silos. In my opinion, our nation and the world needs aspirational goals that we can collectively work toward and make and help to accelerate all the good work that people are doing. Collectively, we can achieve much more than individually. You know, there's an old African proverb. It says on this slide, you want to go fast, go alone. You want to go far, go together. We need to bring together people from every sector, academics, government, business, healthcare providers, scientists, policymakers, to work on common goals. Now, there are many approaches to this. One approach we are contemplating is to develop a grand challenges for health and medicine. You know, several years ago, the National Academy of Engineering developed the Grand Challenge for Engineering. And this approach has been successful and engaged people in aeronautics, international development, urban planning, health, biochemistry, banking, regulation, technology, humanities, from foundations and universities, government, and the private sector. Their challenges are listed on this slide. You may not be able to see them well, but it's quite amazing. It includes like making solar energy economical, providing energy from fusion, developing carbon sequestration methods, provide access to clean water. And it goes on, including reverse engineer the brain. That's pretty ambitious. And, but also advanced health informatics. Their work has become the basis for many exciting collaborations across the world, across the globe, and basis for university scholarships and programs and K-12 curricula. So I wonder whether we might be able to engage people thinking around big goals together while we're also working on the everyday things. I certainly would like to think about this with all of you. Also, we need to better engage the young people, the future leaders in health and medicine, the future IOM members. Now, currently, we have several fellowships, and we're going to celebrate some of the graduates here today, including the Robert Wood Johnson Fellowship, Merzine Fellows. And our fellows take away an understanding of the importance of evidence-based policy and incorporate it into their future work. Can we create even more points of connection with our young people, the future? The World Economic Forum, for example, has a Young Global Leader program that develops a community of bold and entrepreneurial young people. Can IOM involve more young non-members for the future in some of our work, in our committees, forums, roundtables, and others? Let's challenge ourselves to think, take advantage of their enthusiasm and fresh approach, and find a way to engage more young people for this organization. So, I'm about done. As you can see, we've been very busy. You know, if you look at this slide, I captured this slide in our retreat showing our overall plan. As you can see, we've been assessing the IOM's role and think about how we should move forward. If you look at the bottom of this figure, we've been listening, collecting information, organizing around possible governance changes. And we're building upwards to create a strategic plan that will make our organizations ready, innovate, and impactful. And I'm convinced that in the reorganization, it provides us with great opportunity to take our academy, our organization forward in an impactful way, as I said, in a global way. So when we look to our past, we see visionary founding fathers, the Congress, Abraham Lincoln, who believed in the power of an independent group of people like us to inform the nation's choices. When we take note of the present, we see an environment that's changing quickly for better and worse. And as we start walking to the next few decades, let's seize this opportunity to inspire collective action and improve health across the world. Our IOM has incredible power to shape the future, and I look forward to working with all of you to do so. Thank you very much for your attention. Thank you. Thank you. Thank you. Thank you. I'm happy to take a few short questions. We are just in time right now, on time. Well, I know you're not shy, so we can certainly talk more one-on-one when I have a chance to meet with all of you. But I do thank you very much for welcoming me and giving me such a great start. So thank you again. Thank you. So one of the things I've been really impressed with, as I always said, is our staff, our people. I always said that no organization can be successful without its great staff. And in fact, they are the determinants of what happens, our people. And so we're really fortunate that there are remarkable staff at every level of the organization. And every year at this time, we take a few minutes to acknowledge the contribution of several staff. But let me first ask all of you to acknowledge the contribution of all our staff with a round of applause.